Title of our podcast today is Why RDNs Need to Know About Physical Activity. And I am Linda Snetzelaar, the editor-in-chief of the Journal of the Academy of Nutrition and Dietetics, also a professor in epidemiology in the College of Public Health here at the University of Iowa. And we're talking today about the Physical Activity Toolkit for RDNs. This was developed in collaboration with the American College of Sports Medicine and the Exercise in Medicine Initiative, and several Academy of Nutrition and Dietetics DPG groups were also involved, and they include the weight management, cardiovascular health and well-being, and sports and human performance nutrition DPGs. And it's my honor today to have with me Dr. Melinda Minore, who will be giving us some more information about physical activity. And I want to tell you just a little bit about her. She is a professor emeritus in nutrition at Oregon State University, and her research has focused on the interaction of nutrition and exercise for obesity prevention, health, and performance. And especially she has focused on active women over her research career. And although she's retired right now, she continues to do research, write textbooks, and keeps in touch with colleagues and former students. So welcome today, Melinda.
Thank you. I'm very happy to be here, and I'm happy to talk about this.
Thank you. So my first question is, why was the Physical Activity Toolkit originally developed?
Well, first of all, my own personal research has really been involved with nutrition and physical activity, and a group of us at the American Dietetic Association, or American Academy of Nutrition and Dietetics, realized that dietitians did not know how to talk to their clients about physical activity. They did not know the role that physical activity can play in the prevention and treatment of obesity and chronic disease. And by not knowing that, they only know half of the treatment. They only know half of sort of the mechanisms that might help their clients. So we wanted to help dietitians be more comfortable with making physical activity recommendations, knowing that many dietitians did not get any exercise science or training in physical activity as part of their undergraduate degree. Mm-hmm. I think that's changing now, but in the past that wasn't true.
Yes, so important, and I think too, things may be changing, but I know in the past it was not certainly a focus in curriculums that were offered to RDNs. So I know that you've talked about the fact of why this is needed in our profession. I'm wondering, are there other audiences that would benefit from use of the toolkit, and how did you make decisions about what your audience would be?
Okay, so our primary audience was the dietitian and the clients they might work with. So it was really designed to help them talk about physical activity with their clients. And one of the things that prompted this whole discussion was when I would ask students or dietetic interns why, when they were doing patient counseling, they never ask about physical activity of their clients. They said, well, we wouldn't know what to say if they even told us what they were doing. We don't know what they should be doing, and so we don't want to ask a question when we don't know how we should respond. Mm-hmm. At the same time, I think people with physical activity or exercise backgrounds, sometimes they cross over and they think they know more about nutrition than maybe they do and what their clients, and what they're really trained to talk about. And so that was why we partnered with the American College of Sports Medicine and their Exercise is Medicine initiative is to really help dietitians as well as exercise professionals work together. They need to appreciate each other, and they need to know the basics of why nutrition is important or exercise is important, but they also we're not expecting dietitians to be exercise experts. And so it's to try and get these two groups to interact and know where they're in their scope of practice and when they're out of their scope of practice. And I have to say, I think I have spent my whole academic career trying to get these groups to talk to each other and appreciate what the other can bring to the table so that they can treat their clients better.
Yes, so important. So your audience really is kind of a dual group, and that's incredibly important because just as you're saying, they need to work together. And so this toolkit could be really important too in sort of increasing that level of collaboration between those two groups.
Yeah, just making them feel comfortable in talking to each other, because every profession kind of has their own lingo and terms. And that way, I think they're more on common ground and having discussions. I can also tell you that over the years, I've seen dietetic students much more interested in exercise, personally more engaged in exercise than I would say when I began my profession. So I think they're much more open to learning and interacting and talking with the other side.
Yes, yes, so important. What are some of the takeaway messages that you feel are important from the toolkit?
Well, probably the biggest thing is to get RDs that don't already feel comfortable talking about physical activity to feel comfortable recommending it, talking to their clients, asking their clients what they're doing, especially as it relates to the particular health issue they may be interacting. So maybe it's diabetes, hypertension, cardiovascular disease, eating disorders, weight management. So they kind of have a sense of what the physical activity side of that disease might look like and why it's important. And to be able to say to a client, I think you need to start moving more, and this is why, and this is how it might help your blood pressure or how it might help your blood glucose. So I think they just have to have a better understanding of the pathophysiology on both sides of both the nutrition and the physical activity side. One of the things we emphasize in the toolkit is how to find an exercise professional that you can refer your client to if you don't feel comfortable with what you're doing. Nobody expects a dietitian to sit down and write out a physical activity training program for somebody. But they should know what is recommended in the physical activity guidelines for Americans. How much aerobic activity and what does that mean? How much strength training, what does that mean? And how can they motivate their clients, and how can they connect them to community resources that will help them? So I guess those are the key take-home messages. And as I mentioned earlier, sort of my own personal underlying message is, if dietitians aren't active and they read the toolkit, they'll say, wow, I think there might be some real health benefits if I get active and I can relate that to my clients as well, that I know what it's like to be physically active.
Yes, great point. It's always important if you can provide some of your own experiences, I think. So I think that's a great positive. And then finally, what might clinicians who want to use the toolkit in dietary practices, what are some things that they might do to really make this a huge part of what they're doing in terms of counseling patients?
Well, I think that was one of the main sort of drivers of this in terms of how can we actually sort of step a dietitian through this process. So first of all, exercise is medicine, and of course the website is listed there, has all sorts of tools how to work with clients with individual health problems. Let's say you have someone who's disabled. Let's say you have someone with hypertension. They give very clear guidelines on terms of the physical activity. So I think you can go to those resources and you can feel comfortable about the recommendations you're making. It also gives you a way to basically do a physical activity assessment in terms of simple questions and finding out what your client's currently doing. So, and then compare that to the recommendations. The other thing we've done to make dietitians feel more comfortable is we have 5 case studies in the toolkit where we walk through the very, very specifics of how to do a nutrition assessment. You know, the whole nutrition care process. We go through each step of it, how to code what you're doing. And the case studies, one is on cardiovascular disease, one is on obesity, one is on a client who's overweight, one's on diabetes, and one is related to sports performance. So we've sort of, you know, given everything you need to do if you wanted to start incorporating that into your practice. So I think it really is a toolkit in that sense. It's sort of like do step 1, do step 2, do step 3.
Mm-hmm. Yes, I'm hoping that many of the Academy members will go to the site and will certainly try to make use of the toolkit, because it sounds like something that will really add to what we're doing relative to counseling, but very much also become a sort of a usual part of what we do when we're talking to our clients. And as you've said, when we look at diabetes, for example, we are looking at diet and we're also looking at exercise as an incredibly important piece to good control. So
yeah, I'm hoping, that instructors, faculty members that are teaching can use the case study. So if they're teaching medical nutrition therapy and the topic is diabetes, we have a whole sort of protocol, evidence-based. This is what we do, but there is the same kind of thing on the exercise side. So I think they can use the case studies. We even put the answers in the toolkit so they can use them with their students. So I'm hoping that it will be adopted and used that way, because we've done the hard work for the instructor and putting it together. Mm-hmm. And hopefully students can see, oh, I need to know about physical activity as well as the medical nutrition therapy side of things to treat my patient.
Yes. Yes, I so totally agree, and I will be using it in the classes that I am currently teaching in a clinical nutrition master's program. Thank you for all of the work that you put in to make this toolkit a reality. And I so appreciate your talking with me today.
No problem, and I appreciate you asking me.
Thank you so much.
All right, thank you. Bye.
Bye.